It's 2 in the morning, and your tongue won't stop pressing against the sore spot in your mouth. There's no pharmacy open, no dentist on call. Just you, the dark, and a pain that gets sharper every time you swallow. You could reach for ibuprofen, swallow it with a glass of water, and be asleep again in 20 minutes. For most of human history, that option didn't exist. This kind of pain wasn't a rare bad night. It was a regular part of being alive. Right now, close to half the people on Earth still live with some form of oral disease, according to the World Health Organization. That's not a typo. Billions of people, in a world with antibiotics, fluoride toothpaste, and same-day root canals, still go to bed with a hurting mouth. So, rewind the clock. What did people do before any of that existed? Before painkillers, before a dentist's chair, before anyone even had a word for what was rotting inside their own mouth? The answer is older and stranger than you'd expect. Start with the oldest evidence on record. Not from your species. From the species before yours. At a site called Krapina in modern-day Croatia, researchers uncovered a set of teeth more than 130,000 years old. They belonged to a Neanderthal, one of the heavy-browed, thick-boned relatives of modern humans who lived across Europe long before Homo sapiens arrived there. Anthropologist David Freyer and his team studied the teeth under a microscope and found something unmistakable. Deep grooves worn into the gaps between them. Faint scratches across the enamel. 2 of the teeth pushed slightly out of their normal position. Freyer's conclusion was simple. This Neanderthal had a painful, impacted molar, a tooth that hadn't grown in properly and was crowding its neighbors, and had tried again and again to do something about it. Something thin and firm, maybe a sliver of bone or a tough blade of grass, had been worked into that gap so many times it carved permanent marks into solid tooth enamel. Not once, repeatedly, probably over weeks. Why does that detail matter so much? Because it means before modern humans had even spread across the planet, before agriculture, before writing, before anything you'd recognize as civilization, a Neanderthal was already doing something completely familiar. Self-treating a toothache. That's the same impulse running through you right now. Tongue pressed to that sore spot, refusing to leave it alone. If you've ever pictured Neanderthals as dumb, club-swinging brutes who just gritted their teeth and suffered, this single set of grooves quietly argues otherwise. Move forward more than 100,000 years. And the evidence gets even harder to believe. At a site called Mehrgarh, in what's now Pakistan, archaeologists found a Neolithic graveyard, a burial ground from one of the earliest farming societies on Earth, dating back roughly 9,000 years. A 2006 study published in the journal Nature examined the molars of 9 adults buried there. 11 of those molars had holes drilled straight into them. Not after death, while the person was alive. The holes were small, precise, and placed exactly on the chewing surface of the tooth. How do you drill a hole that clean with no metal and no electricity? Almost certainly with a bow drill. A simple wooden bow with its string wrapped around a stick tipped in sharp flint, spun back and forth fast enough to bore through solid enamel like a tiny lathe. Researchers later rebuilt the tool and tested it on isolated teeth. It drilled a hole in under a minute. There was no anesthesia. No way to numb the area, sedate the pain, or even guarantee the patient would hold still. And yet the patients lived. Several of the drilled teeth show new tissue growth around the hole afterward, which only happens if the person survived the procedure and kept living for years. This wasn't a single strange case either. The same practice turns up again and again across more than 1,000 years at that one site. Somebody at Mehrgarh had, in effect, built a dental clinic. Crude, painful, but genuinely functional. And the ingenuity didn't stop at drilling. At a cave near Launch, in what's now Slovenia, researchers used X-ray imaging on a 6,500-year-old human jawbone and spotted something packed into a cracked canine tooth. Infrared analysis confirmed it. Beeswax. The crack ran down through the hard outer enamel into the dentin underneath, the softer, nerve-rich layer that turns painfully sensitive the moment it's exposed to air or pressure. Someone deliberately sealed the crack to block out food, air, and pressure. That is functionally a filling. The same basic idea your own dentist uses today, just swapping warmed beeswax for modern composite resin. So picture the actual scene. You're an adult living near Mehrgarh 9,000 years ago. Your molar has been throbbing for days, the pain spiking every time you chew, every time the wind touches your face wrong. There's no clinic down the road, but there's someone in your community who has done this before. You sit on packed earth, back against a post. Someone holds your jaw steady against their knee. You hear it before you feel it, a faint, rhythmic creak as the bowstring soars back and forth. A small bow appears, a flint tip spinning where the cord meets the wood. It presses into the tooth and the bow saws back and forth. Fast, precise, deliberate. Within a minute, it's over. There is blood and a blinding spike of pain, But then, relief, it worked. And then, somehow, civilization forgot. Here's what the history books skip. The more organized a society became, the worse it treated toothaches. As farming spread, and diets shifted towards soft grains and starches that stuck to the teeth, cavities exploded. Bioarchaeologists comparing skeletons across the transition to farming documented dramatically worse tooth decay in early agricultural populations compared to the hunter-gatherers who came before them. More pain, more often, in more people. So how did these newer, supposedly more advanced societies respond? Not with better drills. With magic. In ancient Mesopotamia, toothaches were blamed on a tiny worm, imagined burrowing through the tooth and gnawing a hole from the inside out. The belief spread to Egypt, India, and China, and stuck around for thousands of years. The Ebers Papyrus, an Egyptian medical scroll from around 15 MFT BCE, prescribes pastes of dough, honey, and herbs packed onto the tooth specifically to drive that imaginary worm out. Egyptian folk remedies reportedly went even further, recommending a freshly killed mouse pressed onto the sore gum while it was still warm. Think about what that required of a person in pain. To trust that a warm, dead mouse pressed to the gum was medicine, not madness. That's not ignorance. It's desperation dressed in the only logic available. Centuries later, the Roman naturalist Pliny the Elder was still recommending burnt wolf's head ash rubbed into an aching tooth. The toothworm idea didn't quietly fade after Egypt and Rome either. It persisted straight through medieval Europe, where healers still blamed toothaches on the same imaginary creature more than 3,000 years after Mergar's drills had already proven the real cause was mechanical, not magical. The early farmers had a physical answer. The empires that followed lost it. The flint drills and beeswax seals of the Stone Age were genuine, practical fixes for a physical problem. The toothworm was a story dressed up as an explanation, and it would take thousands of years and a great many dead mice before dentistry quietly caught back up to where it had already been. That twist is worth sitting with for a second. The primitive toolmaker with no writing and no formal medicine was solving the real physical problem with a drill and a sealant. The literate, organized civilizations that followed spent millennia chasing an imaginary worm instead. Progress, it turns out, isn't a straight line. Sometimes it's a few thousand years backward before it goes forward again. Which brings it back to you, lying awake with your tongue pressed against that sore spot. You're not doing anything new. You're running the same basic program a Neanderthal ran 130,000 years ago at Krapina. Locate the source of the pain and try, however clumsily, to do something about it. The only real difference is what happens after. You can call a dentist in the morning. Your ancestors couldn't call anyone. They had to be the dentist, the patient, and the entire medical system, all at once, armed with a flint tip and a steady hand. And somehow, often enough, it worked. So the next time a dentist's drill makes that sound you hate, remember exactly what it's connected to. A direct, unbroken line of people trying to solve the exact same problem you have, stretching back further than agriculture, further than cities, further than your own species. The pain in your mouth right now isn't new. It's one of the oldest, most human experiences there is. And for the first time in 9,000 years, you get to fix it without anyone holding your jaw against their knee.